My name is Dr. Daniel Liu, and I'm a plastic and reconstructive surgeon here at CTCA Midwestern Regional Medical Center, and I specialize in reconstructive microsurgery. I was born in Shanghai, China, and received the majority of my education and training here in the United States. I attended medical school at Washington University in St. Louis, and then went on to a combined plastic surgery residency training program in Seattle at the University of Washington. There I received specialized training in microsurgical techniques, which I apply on a daily basis here in my job. One of the newer procedures that we've brought to CTCA is the surgical treatment of lymphedema. Lymphedema is a problem in the United States that's primarily caused by the treatment of cancers, specifically with removal of lymph nodes when treating cancers. We often see women who have lymphedema in the arms after a mastectomy. In the last 5 to 10 years, surgeons around the world have developed new techniques to address this problem using surgery, and this technique that we recently performed is called a vascularized lymph node transfer. Vascularized lymph node transfer is basically transplanting working lymph nodes from one part of the body and to another part of the body where we are missing lymph nodes. So for example, in a woman who's been treated for breast cancer and missing working lymph nodes in the armpit, we often borrow good lymph nodes from the groin area and transfer them along with blood supply to the armpit. So it's very similar to an organ transplant, but within the same body. Outside of the vascularized lymph node transfer, the other procedure that is gaining popularity for the surgical treatment of lymphedema is called Lymphaticovenular bypass. It's a specialized procedure that's only performed by a handful of surgeons throughout the country and the world, and it uses specialized technology in terms of operating microscopes as well as experience in microsurgery. And with the current technology, we have the ability to connect dilated lymph vessels in the arm or the leg to small veins that are of similar size to offload the pressure. Patients who are candidates for lymphedema surgery are primarily those who have had cancer treatment and are living with lymphedema as a result of removal of lymph nodes. Commonly we see that in breast cancer patients, but it can also affect patients with melanoma, gynecologic malignancies, or abdominal tumors as well. Patients who have lymphedema have it for a very long time, and we have to make sure that they receive the optimal treatment using existing methods that don't involve surgery first. The team approach for the treatment of lymphedema is extremely important. It begins with basic physical therapy and being able to offer all the modalities that are currently the standard of care for lymphedema. Fortunately, we have that here at CTCA, and we often involve our physical therapists when dealing with these patients. Not only do they receive the necessary preoperative care, but we make sure that they follow up and receive good postoperative therapy. There's a huge number of patients who have been living with lymphedema, and they don't know that surgery is an option for them. And now there are more and more centers throughout the world that are offering this procedure. I'm very happy to say that CTCA also has the ability to offer this as a full spectrum of cancer treatment. And more women with breast cancer are becoming breast cancer survivors, and this is a huge quality of life issue. And providing a surgical treatment of lymphedema to maintain a better quality of life is extremely important for these patients.